Hello, my name is Ying and I work at Sunnybrook Health Sciences Center. And today I'll be going through a module on the topic of blood-brain barrier opening with focused ultrasound. The objectives of this module include having a good understanding of the rationale for temporary disruption of the blood-brain barrier, mechanisms and determining factors of focused ultrasound-induced BB opening, discussing the advantages and disadvantages of focused ultrasound, and giving you an overview of the preclinical and clinical data to date. This is an early study in rodents that looked at a radio-labeled drug. This is a full body radiograph that basically showed an exclusion of the compound from both the brain and spinal cord. And this is because of the presence of blood-brain barrier. The blood-brain barrier is located at the capillary endothelium and is consisting of the tight junctions and efflux transporters, such as P-glycoproteins, that either prevent compounds from crossing the blood-brain barrier into the brain or remove compounds back into the systemic circulation. Why does the blood-brain barrier matter? The blood-brain barrier is essentially responsible for low penetration of a majority of pharmaceutical in development at the moment. Various drugs that currently are developing are too large to cross the blood-brain barrier. For instance, a significant class of drugs such as monoclonal antibodies have only a brain to plasma ratio of less than 0.01%. So by increasing the bioavailability of these drugs in the brain, we can significantly increase potentially its efficacy, as well as reducing cost of these drugs by reducing the dose that we might have to administer these drugs systemically. Current drug delivery strategies include physical methods and chemical methods. When we think about physical methods, these include implantation of wafers or biomaterials that are impregnated with the drug itself, or infusion catheters that are connected to a pump. Some of the disadvantages of these modalities include the fact that patients do have to undergo surgery in order to have the implantation occur. And there's a concern that the diffusion of the drug away from the catheter tip or the biomaterial is relatively low. And also when we think about delivering the drug to various areas of the brain, this is a potential pitfall of this technique, as it's difficult to have multiple catheters or surgeries throughout the brain. Another strategy for delivering drug into the brain are chemical methods, and this could include modifying the drug itself to improve its permeability across the blood-brain barrier, as well as injecting intraarterial compounds such as mannitol that can temporarily disrupt the blood-brain barrier. What we gain with being less invasive, we lose in terms of spatial specificity. So if we can develop a technique that take advantages of both of these strategies, that is a strategy that is repeatable, is safe, and is spatially targeted and non-invasive, then we can potentially have a huge impact in the treatment of patients with various neurological disorders. And some of these disorders include patients with brain tumors, with neurodegenerative disorders, where a significant number of these drug in development are monoclonal antibodies, which are too large to cross the blood-brain barrier to an effective degree, as well as single genetic disorders where gene therapies are under consideration. Brain recovery, where a neuroprotective or neuroregenerative strategy is taken to help the brain recover from stroke or trauma. And finally, psychiatric disorders, where you might want the drug to be delivered only to a certain area of the brain circuit and not have an effect on the whole brain itself. So when we use therapeutic ultrasound, this describes the application of ultrasound to have a therapeutic effect to tissue. One of the advantages of focused ultrasound is the ability to have an effect on the distant target without any injury to the intervening tissue between the transducer and the target itself. When we apply focused ultrasound to the brain, we can have multiple different biological effects depending on the parameters that are being used. And these modalities might include being able to do surgery, to open the blood-brain barrier, to modulate the brain, and to thrombolize clot, all done fairly non-invasively. This slide illustrates some of the current applications of focused ultrasound. On the left is one that has the most robust amount of clinical data to support its use, and that is using focused ultrasound for thermal ablation. For this procedure, patients are typically placed into a stereotactic frame, and ultrasound beams are used to increase the tissue target temperature over 65 degrees to create, over 55 degrees to create a very spatially precise lesion. And this is useful for treatment of patients with movement disorders, as well as various other disorders that are currently under investigation, including pain, psychiatry, and others. The middle panel is an illustration of how blood-brain barrier might occur to deliver a systemically administered drug. And this is obviously the topic of this module and be further illustrated in the following slides. And on the third panel is an illustration of focused ultrasound neuromodulation. Current neuromodulation techniques that are widely used in clinic include transcranial magnetic stimulation as well as deep brain stimulation. Some of the disadvantages of these techniques include the fact that transcranial magnetic stimulation typically used for superficial targets and faces their challenges when trying to stimulate deeper targets, but it is non-invasive. On the other hand, deep brain stimulation requires the implantation of an electrode, so it requires open surgery, but we're able to modulate targets very deep to the brain itself. So focused ultrasound might be a potential modality to bridge between these two technologies in its ability to modulate targets that are deep to the brain without open incision.